morning, everyone, and thank you for joining us. We begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. We are also joined this morning by Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Adrian Battle, Director of Metro Nashville Public Schools. Dr. Michael Caldwell, Metro's Public Health Director, is here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. I'd like to thank everyone across Davidson County for continuing to closely follow the Safer at Home order. By remaining at home whenever possible and observing social distancing, by keeping a minimum of 6 feet of distance from others while being outside and running essential errands. Our thoughts are with all those who are sick with the coronavirus and the loved ones of those who have died. We are at a critical time in our city's response to this terrible disease. Our area hospitals are depending on all of you to help flatten the curve of COVID-19, to support our local first responders and frontline healthcare providers. Now, today's pleasant weather will provide many of us with a welcome respite from our indoor routines. You should enjoy the outdoors as much as you can while practicing safe social distancing. Otherwise, if the nature of your business outside your home is not essential, please remain comfortably at home and remind your family and your friends to do the same. The Office of Emergency Management and Metro Public Health Department, in cooperation with our local healthcare providers, have been working to develop a community assessment system to support the screening and testing resources that area hospitals already have in place throughout Nashville. We have successfully launched our first 2 community assessment centers, one location at Nissan Stadium in Lot N as in November, and one location at Meharry Medical College at 918 21st Avenue North. These 2 sites are open as of this morning. And final preparations are underway for a 3rd assessment center at the former Kmart store in Antioch near 2491 Murfreesboro Pike, which has a targeted opening date of Wednesday, April the 1st. Hours of operation for all 3 locations will be 9 to 3, 9 a.m. to 3 p.m., Monday, Wednesday, Friday until further notice. Other site locations are being determined at this time. Now let's talk about the system. The community assessment system includes the COVID-19 hotline, which residents must call to receive an initial assessment by a public health professional. The COVID-19 hotline phone number is 615-862-7777. Remember that, 862-7777, and will operate from 7 a.m. to 7 p.m., 7 days a week, both in English and in Spanish. If determined necessary during their COVID-19 hotline assessment, residents will then be directed to visit a COVID-19 community assessment center, where they will be further screened and, if required, tested. Again, all residents should first call the COVID-19 hotline at 615-862-7777. In-person visit to the Community Assessment Center. Now, I'm grateful to Director Chief William Swan in the Office of Emergency Management and the Nashville Fire Department for joining us this morning to provide more details about the Community Assessment System. I also want to thank Dr. Adrian Battle, Director of Nashville Public Schools, for being here this morning to provide more details on how our school system is assisting and engaging our students and their families at this time. Now, as a reminder, residents can visit covid19.nashville.gov to make a contribution to the COVID-19 Response Fund, which has been set up to help our fellow Nashvillians who are facing hardships during this time. You can also visit the website to find information on how to obtain direct financial, food, housing, mental health, social services, unemployment, and utility payment assistance. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest information for Nashville. We now have a total of 434 confirmed cases. Yesterday, we had our third death in Nashville, a 69-year-old gentleman. You know, our sympathies truly go out to his family and his friends. We have had an increase of 49 cases in the past 24 hours. The patients range in age from 2 months old to 84 years old. Of the confirmed cases, 14 are currently hospitalized. 337 cases are self-isolating at home and have mild to manageable symptoms. 80 people who have recovered from the virus are now cleared. As the mayor said, this morning we launched a community assessment system for Nashvillians who are concerned that they may have the virus. The assessment system consists of two parts, a hotline and an assessment center. It all begins with the hotline. If you think that you may have the symptoms, please call 615-862-7777. This hotline is staffed by healthcare workers who will answer your questions and help you determine whether you need additional assessment. Based on your information, the hotline may refer you to your local healthcare provider or to one of our community assessment centers. These drive-through centers will do an additional assessment of your symptoms and, if indicated by medical protocol, give you a COVID-19 test. This morning, we have opened a center at the Nissan Stadium parking lot N, and in conjunction with the COVID-19 task force, Meharry Medical College has opened a second location. As the mayor noted, on Wednesday, a third center will open in Antioch on Murfreesboro Pike. The community assessment system supplements the care that is already being provided by our hospitals and medical schools in Nashville. It expands our city's ability to assess more residents and conduct even more tests. And as a reminder, you will not be charged for the assessment or, if you need it, the COVID-19 test. Over the weekend, Director Chief Swan and I met with our state and federal partners to discuss plans for additional hospital capacity, if we need it. I want to be clear, right now the hospital systems in Nashville are keeping up with the demand. But still, we're concerned that over the next several weeks, a growing wave of COVID-19 patients will require hospitalizations and perhaps intensive care treatment, putting additional stress on our healthcare system. If it does, we need to respond with additional capacity and healthcare resources, which includes beds, supplies, ventilators, and most important, staff who can provide care. Our city, along with regional and state partners, are taking the actions needed to be prepared, but we need your help. The best way you can help lower the need for a surge hospital capacity is not to get the virus in the first place. That's why we have issued the Safer at Home order. It will help flatten the curve and reduce the demand on our hospitals and our healthcare workers. This reminder that under the Safer at Work order, construction, lawn care, and other services considered essential remain open. But for all essential businesses, it is important to practice social distancing. This is not during work hours alone. It's also during meal times and other breaks at work. Stay 6 feet, which you can determine if you just put your arms out, and don't go to work or the job site if you are sick and have symptoms of COVID-19, which include cough, fever, or shortness of breath. It is the best way you can help. You truly can save lives. Finally, today is National Doctors Day. While this is not typically a day I give much thought to, this year is different. I want to express my thanks to all my colleagues and friends in the healthcare professions. I know firsthand the sacrifices you are making and the worries of your families and friends. As each day goes on, it is truly evident that we are all in this together, and together we can make a difference. I thank you all so much for your support. And now I'd like to turn over to Director Chief William Swan, who will discuss the assessment centers as well as our homeless response. Chief.
Well, first, let me thank the mayor and Dr. Jahanger. And as stated before by them, I want to talk about the assessment centers. 2 assessment centers sites have been opened this morning. Nissan Stadium, Lot N, and Meharry Medical College. These sites are fully staffed and operations are going well. I want to remind residents you must call the COVID-19 hotline first to get the initial assessment. A third site is set to open on Wednesday, April the 1st at the former Kmart site, Murfreesboro Pike 2490. Sites will operate on Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. I also want to share a little information about our overflow shelters for the homeless. Are open and operational as a 24-hour shelters. There is one location that has 2 buildings. One building is for those who are not symptomatic, and the other is for those who have been tested and waiting for results. There is a second location that is staged to shelter for those who are confirmed positive for COVID-19, but there are no known cases at this time. Currently, we have 50 personnel that are staffed, 50 persons that are sheltered, and this number could increase. Shelters are maintaining the current CDC recommendation to keeping the 6 feet of distance. There are 3 meals that are being provided by the Second Harvest Food Bank. Shelter management is being provided by Metro Department Social Services. And we want to also thank our Metro schools to helping us transport the patients from the shelters, from the mission to our shelter at the fairgrounds. These transported are being screened by St. Thomas staff prior to getting on the bus and then after they arrive at the shelter. Every day at the shelters, they are taking an AM and PM temperature for those that are not showing any signs or symptoms, just to be sure that we are doing everything possible to take care of our homeless and ensure that they're getting the proper care. Also, I want to take a moment just to thank not only our healthcare providers and our doctors, our first responders that's doing their job. We ask for everybody to just keep us in your prayers, and I know with much prayer and hard work, we'll get through this like we do everything else. Now I would like to take this moment to introduce Dr. Battle. Thank you.
Thank you. As you know, schools are closed at least through April 24th, but our teams are out working to support the students and families of Metro Nashville Public Schools. Last week, our nutrition services and transportation teams delivered more than 22,000 breakfast and lunch meals for children under the age of 18 across Davidson County. And we're continuing to do that this week and every day that schools remain closed. We've added new sites to meet the needs of the community, and we recommend you go to www.mps.org/COVID-19 to find out where you can get those meals if you need them. Starting today, we're delivering distance learning materials to those meal sites for parents and students that don't have access to technology. That material, along with other resources, is online at www.mps.org/digital tools for those who want to download them. Our teachers will be engaging their students with these enrichment materials throughout the week through phone calls and online for apps to make sure their needs are being met. Our teams are also working on an accessibility and accommodations resource guide that will be released later this week. This material is in addition to the great programming that's now being offered on Nashville Public Television or Channel 8. Also this week, we have begun the process of getting laptops to seniors that need them in order to participate in credit recovery programs so they can graduate on time at the end of the school year. Teachers and principals should be in contact with their students to discuss their needs, and starting tomorrow, there will be a hotline at 615-269-5956 so that students that want to make a reservation can do that at a location near them. Thank you.
Thank you, Dr. Battle, Chief Swan. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Tosin at News 4.
Good morning, Chris. Good morning, everyone. My question goes to, do we expect to see a huge jump in numbers now that these assessment centers are open? And I guess, I know last week Dr. Jahangir said, we have enough to open for an infinite amount of time. So do we know if we have everything we need for, I don't know, a month, 2 months, 3 months? What are we prepared for?
Dr. Jahangir.
Thank you so much, Tosin, for that question. In regards to the part about will we see the numbers jump up? I mean, short answer is I don't know, right? We're currently in Nashville, about 9% of people who are tested turn positive. As best practices have shown across the world, it is really important to test as many people who meet criteria as possible so that you have an idea of the incidence of this disease in your community. And so we may see an increase in numbers, and that's what we need to know as public health experts to make decisions. Or we may realize that the disease is not as prevalent in our area as we worry that it may be. So that's why testing is important. Second question is, everything has a finite number. We're fortunate from the Unified Command to get a reasonable amount of test kits and swabs to open these centers up for, we believe, for at least several weeks. But we are continually working to continue our supply of swabs and other PPE, again, working with our state and private partners. As a city, we're doing everything we can, and we're going to keep working with our colleagues and putting pressure on those that have access to these swabs to make sure that they give them to our community, because, again, this is a very large community in the state and one that really we can determine how that we're doing winning or losing in this fight against this virus. Thank you.
Nancy Ammons.
Hi, thanks for taking my call. Are you concerned about a surge of patients coming from counties outside of Nashville, especially counties where the hospitals have closed? And what kind of numbers are you preparing for this surge that we hear may be coming in mid-April?
Nancy, the short answer is, of course, Nashville is a healthcare capital for not only this region, this state, but also surrounding states, right? So while the numbers I report in the morning are number of hospitalized Davidson County residents in our hospitals, there are more individuals in our hospital system currently that are ill that are not Davidson County residents. So, of course, this is top of mind for not just me and the mayor and Dr. Caldwell and Chief Swan, but yesterday I spoke with almost every senior leader at each health system. This is very much top of mind for us, and as we look at models and so forth, we think about raising capacity for many hundreds, if not more. And so the key, though, is, and I apologize if I'm redundant, I keep saying this in any interview, it's a supply and demand issue. We could have 200,000 extra beds put in Nashville for people, but if a lot of people get infected at one time, a certain percentage of those people are going to need those beds. So the best thing to do is flatten the curve, make sure that we don't have as many people infected at one time, and at that point, hopefully we can meet whatever capacity we need. But yes, we are a regional healthcare system, if not a national healthcare city, and so we need to be prepared for individuals outside of our county or on our borders. So thank you.
Ian Jung with the Tennessean.
Good morning, and thank you for today's update. What type of protocols are in place in Nashville to make sure nursing homes are protected and they properly notify Metro Health if an outbreak occurs?
Dr. Caldwell.
Good morning. nursing homes and assisted living are a big concern, especially with the news that we heard over the last 24 hours. I can tell you that we have had a representative here at the Emergency Operations Center, specifically from the nursing home assisted living community, and they are briefing us daily. This morning I just had a morning briefing to review everything that we know from the Tennessee Healthcare Association, which is the professional representation of all the nursing homes and assisted living in our area. And we are going to be in heightened direct contact with them. It's a concern, but I can tell you they're doing a lot, and it's a burden. There are a lot of nursing homes and assisted living that are having strict protocols to restrict all visitors. They are testing all of their employees on every shift. I am very satisfied that every one of these facilities is doing everything they can. They're in communication with each other to learn best practices, but I know we can do more. It seems that a lot of the spread we're seeing also are from asymptomatic individuals. That's why it's so important that we need to treat ourselves as potentially infectious to others, and anyone we meet could potentially be infectious to us. And that's why Mayor Cooper, Dr. Jahangir, and I are continuing to ask everyone to be safe at home, flatten the curve, and don't be a vector. Thanks.
Nayeli with El Jefe, 96.7 FM.
Hi, thank you for taking my question. Can you hear me?
Yes, please go ahead.
Okay. I have a question. Thank you so much for taking my question. I wanted to know, you guys said that there will not be a cost for these tests, but there has been a doubt for those who do not have a legal status and who do not have insurance. How will this affect them, or will it affect them?
Yes, Dr. Jahangir.
Thank you for that question, and it's a really important one. I want this to be very clear. When Mayor Cooper charged us when he asked me to join this, he said, what's the best way to take care of our residents in Nashville? And best practices show testing is. And so when we set up these systems, we set up a system in which, irrespective of your ability to pay or any other situation about that makes you a Davidson County resident, you will get assessed and tested. There will be some minimum information we need to collect at the assessment centers, especially if we get a test of you, so we can call you in case your test results, or to make sure to let you know if you're positive or negative, or precautions you may have to take. But short of the required information we need to be able to get back in touch with you to get your test results, we're not going to ask anything beyond that. And again, for Davidson County residents, which is what the system is set up for, there is no cost for these assessments and tests. So thank you.
Harriet Wallace with Fox 17.
There is obviously great concern with people who are violating the social distance order. My question is, what is anyone who would like to speak to this, your response to those who are not taking this seriously, putting lives in danger, and are continuing to go out with beautiful weather ahead, and what will be done to further enforce this order? Thank you.
Dr. Caldwell.
This is difficult for our community. We want everyone to do their best to stay at home, be safe at home, limit their errands. But we are encouraging people to go outside. But we want to reinforce how important it is that you do keep that social distance. And you're right, we're seeing, especially yesterday, that not being followed as much as we'd like it to. So I'm working with the mayor and Dr. Jahangir on ways that we can have a measured approach to keep reminding people, and if necessary, look at other additional enforcement measures so that we can make sure we stop the virus in its tracks. Now, many people don't walk around the Greenway like this. However, I think it wouldn't be a bad idea to just remind people we're all in this together, and to have just a little reminder that this is what we really are looking for. I'd like very much that if you see people doing this on the Greenway, that you receive it as a welcome gesture and not as a gesture that is in any way showing that we're not enjoying each other's company. Let's try to find ways to remind each other that socially distance is really important. But we need everyone's help. I went to get a coffee recently, and it was a place for takeout. And I saw that they had blue X's on where you should stand. I think this is great. We want to share these best practices and ideas. We're relying on the community to inform us of what their ideas are so that we can share all of them and keep that virus away, flatten the curve, and that we all are not going to be a vector to infect other people. So thank you.
It looks like there are no more media questions at this time. A video recording of this broadcast will be made available later today. Thank you, everyone, for joining us. This concludes today's COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this